If I used the description, the mouth feels bad, the gums are detached from the teeth, blood runs from the nostrils, ulcerations on the legs, some of these heal, skin is thin, from Hippocrates, would you know what I was talking about? Honestly, I wouldn't either, but actually it's something I'm pretty sure everyone has heard of at one point or another. Tales from these pirates and British sailors made this disease infamous, but had its first written record in 1550 BC and has continued on through the ages. I'm actually talking about scurvy. So what is scurvy then? Scurvy is a clinical syndrome that results from vitamin C deficiency. Scurvy may not be a disease that you hear much about in the 21st century. However, it was once the scourge of sailors and other seafaring people, killing more than 2 million sailors between the time Columbus crossed the ocean and the introduction of steam engines during the Industrial Revolution. Scurvy accounted for more deaths than storms, battles, shipwrecks, and all other diseases combined. Even though we don't hear about scurvy much today, it can still be a problem for those struggling to get enough nutrients. The human body needs vitamin C to produce collagen, which is the tissue that connects your muscles and bones and makes up your skin. Vitamin C also helps heal wounds, support your immune system, and help in many other internal processes. So now that we know what scurvy is, let's talk about what scurvy looks like. The first symptoms of scurvy will typically develop after at least 3 months of extremely low vitamin C levels. Unlike most other animals, humans can't make vitamin C within their own bodies. We have to get it from the foods we eat. Scurvy is a progressive disease, and the longer it's left untreated, the more symptoms you'll experience. Some of the most common symptoms include lethargy, along with body weakness, can be so debilitating that you're unable to get out of bed. It's usually the first symptom to appear. Body aches are felt primarily in the joints but aren't limited there. It may feel similar to body aches from the flu. Swelling happens mostly in your arms and legs. The slightest touch will cause bruising. Internal bleeding will cause your skin to look splotchy. Oral problems, your gums turn spongy and porous. Your breath will smell rotten, and your teeth may start to loosen from their sockets. And old wounds open. There isn't enough collagen left in your body to continue creating scar tissue, so old wounds may start opening. Sounds horrific, right? Well, it can actually get worse. If scurvy continues to progress untreated, you will die, most likely from extreme bleeding near your heart or your brain. Not something that sounds terribly fun, does it? But not to worry, scurvy can be survived and is an easily preventable disease. Scurvy was once treated with onions and lemons. Unlike the sailors in the 1700s, who couldn't get fruits and vegetables high in vitamin C on long voyages because it was difficult to keep them from rotting, most people today have vitamin C readily available. Modern treatment of scurvy is quite simple. You'll want to talk to your doctor, but they'll likely recommend adding more fresh fruits and vegetables to your diet. They may also suggest adding a vitamin C supplement. Most patients feel better within 48 hours and are completely cured within 2 weeks. However, if you don't have a pretty significant lifestyle change, you're likely to relapse and contract scurvy again. Now, you're probably wondering why we're doing a video about something that isn't widely seen as a public health issue. Well, actually, there was a scurvy outbreak just 5 years ago. In 2017, an outbreak of scurvy was identified in a refugee camp. Scurvy isn't new to refugee settings, where a limited amount of fresh food is available or affordable. Now you may be thinking, we don't live in a refugee camp, but actually, anyone can get scurvy. Due to the rarity of scurvy, diagnosis is often delayed or missed completely, resulting in potentially serious complications and unnecessary workups. Recently, however, there has been a slight increase in the diagnoses of scurvy in hematology clinics around the country. Certain lifestyle factors can predispose one to be susceptible even in the 21st century. Scurvy may develop if you don't include enough fruits and vegetables in your diet, eat little food at all due to an eating disorder, or a treatment that makes eating difficult, such as chemotherapy. If you smoke, know that smoking limits your body's ability to absorb vitamin C. Having a drug or alcohol addiction for long periods of time, having a poor diet while pregnant or breastfeeding when your body needs extra vitamin C, and having type 1 diabetes, which requires higher levels of vitamin C, are all things that make you more susceptible to getting scurvy. It's important when making decisions, medical professionals take into account each individual patient's specific circumstances. Even 21st century physicians should be alert to the risk factors, signs, and symptoms of this ancient disease.